Hello, I'm Pamela Hicks, Quality Improvement Specialist at the Carolina Center for Medical Excellence, also known as CCME. Today's webinar, Patient Re-Engagement, Annual Wellness Visits and Depression Screening, is sponsored by CCME. CCME is a partner in the Health Quality Innovation Network, known as HQIN, a quality improvement organization servicing Kansas, Missouri, South Carolina, and Virginia. The goal of this webinar is to encourage the use of the annual wellness visit as an opportunity to re-engage patients after limited access to in-person healthcare visits during the COVID-19 pandemic. We will focus specifically on the depression screening component of the annual wellness visit as an evidence-based tool used to assess depression symptoms and determine possible treatment options. COVID illnesses, temporary closure of the economy, as well as strategies developed to mitigate the effects of the pandemic, such as social distancing and isolation, have triggered an array of emotional, physical, and economic issues. Although we have yet to see the full impact of COVID-19, it is apparent that these challenges ultimately affect people's health and well-being, as they influence social determinants of health categorized in Figure 1. The social and economic conditions brought on by the pandemic have exacerbated already existing health disparities in various populations, including the elderly. The risk of COVID-19 infection is greater for older adults, and due to the chronic illnesses and comorbidity, many are at heightened risk for serious illness if infection occurs. This alone can evoke stress and fear. Bereavement from accumulated losses, deconditioning from lower levels of activity, social isolation and loneliness, depression, dehydration, not eating well are all effects of COVID-19 on the Medicare population, which can lead to clinical depression. According to a Kaiser Foundation research study in August of 2020, 1 in 4 older adults aged 65 and older reported having anxiety or depression amid the COVID-19 pandemic. The annual wellness visit allows the provider and care team to fully assess the patient's current overall health and well-being by providing time for candid, in-depth conversation, which is not always possible during other visit types. The structure of the visit allows the care team to focus on preventive screenings and risk assessments specific to the patient, giving opportunity to evaluate the patient's current mental and emotional well-being. Older people are often stoic and are slow to ask for help. The annual wellness visit provides assessments that may uncover issues that the patient would not otherwise address. One of the goals is to refocus the patient's active role in healthcare and gives them leverage to take control of their own health and improve well-being. It's also an opportune time to develop and strengthen the partnership between the patient and the care team. The annual wellness visit process takes a standardized approach to gathering patient information on a personalized level. Let's take a look for a moment at a possible depression screening workflow within the annual wellness visit process. The PHQ-2, which is included in the health risk assessment, is completed by the patient prior to the visit. A designated team member then records the PHQ-2 responses in the EHR flow sheet. Let's say the PHQ was positive. This prompts the clinical staff to provide the patient with a PHQ-9 to be completed in the exam room. Once this is completed, the results are recorded in the EHR flow sheet. The PHQ-9 scored positive for moderate depression. The provider then reviews the results with the patient and discusses underlying issues of loneliness and inactivity. A warm handoff to the patient navigator to discuss community services that are available is made. The patient is given an activity tracker and enrolled in an outdoor walking program. The patient receiving this intervention will then be scheduled for a regular follow-up, and the PHQ-9 will be repeated. Developing a team-based approach is key to improving the patient experience. The model of care strives to meet the patient's need by empowering and actively engaging them in their own care. It is important that a workflow is established to identify appropriate staff responsibilities and procedures for responding to each component of the annual wellness visit. Each team member should clearly understand their role in the process from pre-visit to post-visit activities. Before I leave you today, I want to share a few tips. Let's consider scripting out your outreach message for the schedulers, but we need to allow personalization of delivery. See, it's important to convey the same message. However, adding a personalized flair to the delivery may begin to engage the patient prior to the appointment. Standardized annual wellness visit training is very important to ensure replication of the process. I mean, no patient should be lacking because we forgot to do a PHQ-9 after doing a PHQ-2 that was positive, right? We need to house a resource folder in a central location for all team members to access tools, documents, and tips. Include all potential screenings, referrals, education materials in a comprehensive order set. Develop a community resource plan based on identified concerns and barriers. I'm going to take it a step further. Not only do we need to develop a plan, but we also need to evaluate the community resource plan periodically to determine if any modifications need to be made. I want to thank you for joining us today. If you would like any additional information or assistance, please feel free to contact me at phicks@thecarolinacenters.org. That is phicks@thecarolinacenters.org. Would you like to connect with us? Please feel free to look us up on social media. Thank you.